Coronavirus infections and hospitalizations in the U.S. are falling. The nation is averaging about 107,000 cases per day. That's down from around 160,000 in early September. The head of the CDC says she's, quote, really hopeful that we're in a downward trend. And it comes just in time for flu season. There are mounting concerns that a surge in influenza infections could complicate the nation's pandemic recovery. Anthony Pura reports.
The FDA is considering approval of half doses of Moderna's COVID-19 vaccine as a booster shot to beef up protection against the virus, especially as flu season approaches.
We're coming into a season, we just don't know what's going to happen.
As people start making holiday travel plans, the pilot union is warning that staff shortages could impact family vacations when the federal vaccine mandate takes effect.
If in fact the pilots who are not vaccinated are put on unpaid leave or terminated, that's more than 4,000 pilots at American Airlines that will not be able to fly.
One school district on New York City's Long Island is already scrambling amid an unprecedented bus driver shortage blamed on vaccine mandates.
I wouldn't want my kids with people who are not vaccinated.
All teachers and school workers in New York City have until Friday to get their first dose or risk losing their jobs. Today is the deadline for California healthcare workers to get vaccinated following a new mandate. It includes anyone working in places like hospitals, doctors' offices, and nursing homes. Officials in Los Angeles have delayed a vote until next week on a measure to require proof of vaccination to enter indoor venues like gyms and restaurants.
I think it's going to be kind of impossible because it's already hard to ask people to use a mask.
And the Great White Way is in the midst of its own setback. Wednesday night's performance of the hit Broadway show Aladdin was canceled a day after it reopened when COVID breakthrough cases were detected among the cast and crew. Anthony Pura, CBS News, Los Angeles.
For more, I want to bring in Dr. Anand Swaminathan. He's an emergency medicine physician. Dr. Swamynathan, as we just saw, vaccine mandates are going into effect across the country. As a result, we are seeing some staffing shortages. We heard about pilots, but we're also hearing about those happening at hospitals. Given all of that, do you believe that mandates are the right course of action, and how concerned are you about these staffing shortages?
Well, I think mandates are absolutely the right way to go here. We as healthcare workers have taken an oath to protect our patients. We have a duty to them to be vaccinated, whether it be against measles, hepatitis B, or in this case, COVID. We have a long history of protecting our patients by protecting ourselves, and this vaccine is just another step in that direction. As far as shortages, let's see what actually happens, because we hear a lot of bluster about, well, I'm not going to get vaccinated, go ahead, I'll lose my job. And then as those deadlines approach, a lot of people will get vaccinated. They understand that that is the way both for them to stay employed, but also to protect themselves and protect everybody else around them.
Well, we have been talking about the safety and effectiveness of these vaccines for months, and yet there's a big chunk of the population that's still unvaccinated and many people who are still hesitant. What's at the root of this uncertainty at this point, and is there anything more that can be done to reach these individuals?
Well, I think that there's really multifactorial issues going on here. We have to remember that the unvaccinated are not a monolith. It's not just one set of people who are unvaccinated. There are lots of different issues. There continue to be issues of access, and we have to be working to solve that. We also see huge gaps across the political spectrum, and we have to be working against that as well. There's a huge amount of disinformation out there. We saw yesterday that YouTube was saying they're not going to allow people who are posting anti-vax information to post anymore. That's a great step. But we need to see that on every single social media platform, Twitter, Facebook, Instagram. Every platform needs to be doing the same thing. Otherwise, we're just chasing our tails. We're just chasing on to the next platform that's allowing that to happen. We are spending a lot of time fighting disinformation, but what we need to be continuing to work on is aligning with leaders and communities, giving the proper messaging. And honestly, I think that people who are leaders who are in under-vaccinated areas really should be on a microphone every day, 24 hours a day, saying why everybody should be getting vaccinated.
Well, the head of the CDC says that she is, quote, really hopeful that the summer surge will continue its downward trend. But experts are concerned about a possible overlap of this upcoming flu season and a winter coronavirus surge. How bad might that be, and how do we best avoid that?
I think if we see a standard flu season along with the almost inevitable next wave of COVID that'll be coming in the winter, we're going to destroy hospital systems far beyond what we've already seen over the last couple of months. And last year we had a very mild flu season, and a lot of that was probably because we were masking, we were avoiding indoor situations. And so the basic public health things that we have done in the past can continue to protect us, not just from COVID, but from the flu as well. And it's going to be particularly disastrous if we're seeing people getting both the flu and COVID, but even just regular flu numbers can really overwhelm hospitals. So what we need to be stressing and making it clear is that masks protect you from these respiratory viruses. They protect you from the flu. They protect you from COVID. And if we want to have a mild winter, flu and COVID, we need to be getting some mask mandates back into place indoors, whether you're vaccinated or not. That is the safest thing. We should be starting to think about contracting travel plans. That's another thing that can really help from spreading. But those basic public health systems need to come back into place to help to protect us.
Dr. Swamynathan, the CDC has now come out, quote, strongly recommending women get the coronavirus vaccine before or during pregnancy. I remember that there was a time where there were big question marks about that category, but now the agency says that cases and deaths have been rising among unvaccinated mothers-to-be. Is there enough data now for you to confidently recommend this shot to people who are expecting? And why is the CDC saying this now? Is this a big deal?
It's absolutely 100% a big deal. Honestly, I think that the data has been there for a while now, saying that this is safe for women who are thinking about getting pregnant, women who are pregnant, and women who are breastfeeding. It's absolutely integral. If you want to protect the fetus when you're pregnant, then you have to get vaccinated. That is the best way to protect your future baby, the fetus, from getting COVID, from having any sequelae, and of course, protecting yourself. We see time and time again when it comes to obstetrical issues, if we take care of the mother, we take care of the baby. That is the best thing that we can do. And we need to be, again, very clearly messaging this. And the most trusted people as far as pregnant women are concerned, or women looking to get pregnant, are their OBs and are the nurses that take care of them. And so that's a group that we really should be reaching out to and making sure they have consistent messaging as well. The Professional Society for Obstetrics and Gynecology in the US has been very clear on this, that absolutely 100% women who are thinking about getting pregnant, who are pregnant or breastfeeding, should absolutely get vaccinated as the best way to protect yourself.
All right, Dr. Anand Swaminathan, thank you for joining me, and thank you for all that you do.
Thank you.